And we are live in our YouTube channel. Welcome, dear participants. I will pass the floor to Mr. John Romano, who will be your moderator for today. And that's it. Thank you so much.
Great, thanks very much, Palayo, and thanks very much to UNDESA and UNITAR for setting up these SDG learning events, and welcome everyone to this SDG Learning Lab, just to make sure that you are in the right place. This SDG Learning Lab is on unmasking inequalities, accelerating change, using disaggregated data, disaggregated and citizen-generated data to foster SDG reporting and accountability. We have quite a robust program for you all today. Some great expert insights from colleagues all around the world working on data and disaggregated data for the SDGs. So I'm not going to go into too much detail on the program, other than to say we'll have 3 sessions. The first is an opening session where we'll talk a little bit about the issue of disaggregated and citizen-generated data, give a little bit of background and context to the topic, and a bit of an introduction. We'll then move to a second session on disaggregated data in the context of leaving no one behind. And then a third session on community voices and citizen-generated data. And we'll follow all of that with an interactive question and answer session with all of the panelists after these sessions conclude. So just a quick note, the partners that came together for this SDG learning session, World Vision, Save the Children, Quantu, and the TAP network, all providing a little bit of expertise from our own individual contexts. And just a logistical point, please do take advantage of the Q&A and chat boxes, and participants, in addition to reviewing and discussing questions in the interactive session at the end, our participants will also do their best to respond to these questions as we go along. So please, if you have any questions throughout the discussion, please do feel free to include them in the chat box or in the Q&A box, and our colleagues will do their best to answer them as we go along. So just as a way of an introduction to this topic, we all know that the 2030 agenda calls for leaving no one behind. It's quite a lofty commitment, and we think about how we operationalize that commitment to leaving no one behind. How do we know who is left behind? What does leaving no one behind mean? And one of those ways that we can track how colleagues or how people are being left behind is through data. There's a saying that you can't measure, if you can't measure something, how do you understand how to address these issues? We also know that the 2030 agenda also calls for quality, accessible, timely, and reliable disaggregated data to ensure that no one is left behind. So the 2030 agenda recognizes that data is crucial to ensuring that we leave no one behind. But 6 years into implementation, again, what does this mean? How do we do that? How have we done that to date? And how can we ensure that both official statistical systems provide this data on the government side, but also how do we complement this with non-official data or citizen-generated data? I think there's a wide range of data resources, a wide range of expertise and organizations that can help us track data around leaving no one behind. Civil society organizations, for example, that can track local and grassroots communities and progress and the needs and priorities of these communities better than governments ever could. So how do we do this is the big question today. I think we have about an hour and 45 minutes to solve this dilemma. So we'll get straight into it with a bit of an introduction and background to this topic from our partners. So the first colleague that we have today to provide a little bit of background and introduction is Kevin Watkins, is the CEO from Save the Children UK. So please, Kevin, the floor is yours.
John, thank you so much for that. And thank you to all of our partners and to everybody involved for what I believe is a really critical event for the SDGs. I wanted to start, John, with just a very simple observation that, I think many of us on this call have a research background of some sort or the other. And, we're probably never happier than when we're arguing about the Gini coefficient or about other measurement tools. But interesting as those arguments can be, I think the issue on the agenda today is far more fundamental than that. And basically, I want to say why I think it's so fundamental and how we can do more to take the agenda forward. So the reason that it's so fundamental, I think, is actually articulated in the SDGs themselves. The SDGs are an appeal to universalism, to universal human values. And at the heart of those values, I would say, is a very basic idea that Amartya Sen articulates beautifully, which is that, you might accept inequality in many dimensions of life, but everybody would acknowledge that inequalities related to your chances of survival as a child, inequality related to your prospects for going to school, for getting an adequate diet, inequalities related to disadvantage associated with discrimination based on the color of your skin, your religion, where you happen to live. These inequalities are fundamentally unjust inequalities. We can argue about whether we prefer a Gini coefficient of 55 or 40 or 48, but I think in those other areas, our shared ambition has to be that we move towards zero inequality, however difficult that is to achieve. And actually, that is what is very explicitly stated in the SDG framework, that those who are furthest from the goals will move more rapidly towards the goals than those who are further advanced. So if you like, this is an explicit statement in favor of convergence. I would say that's an overwhelming ethical obligation. But it's all, even if you don't believe that, if you take away the ethics and say, you believe in the SDGs. Now, the SDGs in most areas are unattainable at current levels of inequality. If you take an issue like child survival, which is one of the big ones for us in Save the Children, if you're born into the bottom 20%, your risk of not making it to your 5th birthday are between 3 and 5 times higher than a child born into the richest 20%. Most deaths happen disproportionately among the poor. And so on simple arithmetic, if you want to get to 0 preventable deaths, or you want to get to 0 children out of school, you have to have the greatest progress amongst the children who are furthest from the goals, because that's where the biggest numbers are as well. So there's a simple SDG arithmetic imperative. And the uncomfortable truth is that the 100 and whatever it was, 80 governments who signed up for that equity commitment in the SDGs, I believe did so in the belief that they would never be held accountable. Because let's face it, this has been an era of rising inequality in many countries. And what we can do through data is hold governments to account. So I believe we should be using events like this to really turn the spotlight on, 1, the imperative to accelerate progress at the base of the pyramid, 2, to hold governments to account, and 3, not to just make this a data exercise, but to link it to policy. You don't get improved equity without redistributive fiscal policy, without policies that tackle discrimination and disadvantage based on gender, race, wealth, and other factors. So this is also about the political economy of equity. It's not just a data exercise. And finally, John, I realize I'm running up against the clock. I do believe that that the pandemic has given an added this was an urgent discussion even before the pandemic. What has happened during the pandemic is that the disruption of health systems, of economic systems, of social systems has been a magnifying glass for inequity. You know, millions of children out of school. Who is it who is least likely to go back to school? It's the poorest rural girls. Who is it who is most likely to drop out when they go back to school? It's the poorest adolescent girls. You know, when we look at the data on child survival, and, you know, it's already starting to edge in the wrong direction, who do we think it is who isn't being taken, who are not being taken to health clinics for treatment? So I think the pandemic has given an added urgency to this work, and these clunking surveys where we find out 2 years later what has happened to inequality after the event are just increasingly irrelevant to the real world that we have to operate in. And it's why it's so encouraging that there's I know Winfried is going to speak to this, Oliver and others as well, that we have so many new data sources. You know, we need real-time observed data that provide us with a window on these inequities that, as an act of solidarity, we have to tackle. Thanks, John.
Great, thanks a lot, Kevin. And that's a really great point to frame this entire discussion with, the point that you made about governments expecting not to be held accountable when they signed up for this. And I think also the need to put a human face on this data. I mean, yeah, from the researcher perspective, you know, we can nerd out on the data and statistics all we want, but unless we put a human face on this data, I think it's going to be tough to sell why the imperative of the SDG, the moral imperative of the SDGs and governments to act and to hold them accountable. So thanks a lot, Kevin, for those initial framing remarks for us. Our next colleague we have is Sophia Borges. She is the Senior Vice President and Head of the New York office at the UN Foundation. We all know Sophia very well from around the SDGs, been very, very active throughout and including in the negotiation process. So Sophia, please, the floor is yours.
Thanks, John. Good to see you. And thanks, UNITAR and UNDESA, but also World Vision International, TAP Network, and Quanto for hosting this event. And I remember in the negotiations when we were advocating for Goal 16, one of the biggest pushbacks or obstacles to securing that goal was the held view that SDG 16 was a goal that could not be measured, and therefore it had to be left out of the agenda. 6 years on, it's there and it is measurable, but good to be here with all of you. You know, 6 years on, data remains the backbone of work for achieving the SDGs, and without quality data, as Kevin has also said, there is no way of telling whether we are getting closer to achieving the SDGs, what gaps still remain, and those that are left behind. We have made some progress in this respect, and I think you have seen the SDGs report on SDG progress, which was issued this year. And the number of indicators in the global database, SDG database, increased from 115 indicators in 2016 to 160 in 2019 and to 211 in 2021. At the same time, the significant data gaps and challenges remain, especially when it comes to geographic coverage, timeliness, and the level of data disaggregation. COVID-19 took a toll on countries and communities worldwide, where the most vulnerable are bearing the highest costs and where the fragility of vulnerable groups has been exacerbated by the pandemic. The humanitarian impacts of the pandemic have escalated dramatically, with skyrocketing rates of hunger and malnutrition. 272 million people are already at risk of acute food insecurity. The economic impacts have also been borne unequally, with those in the most vulnerable segments of the formal and informal economy experiencing the most severe impacts. An equivalent of 255 million full-time jobs were lost. The pandemic has pushed an additional 119 to 124 million people into extreme poverty in 2020. A particularly cruel toll has been taken on girls and women, who are the most likely to suffer the protracted impacts of being out of school or out of work. The pandemic has made it clear that we cannot face these challenges alone. If we want to emerge out of this crisis better, greener, and more equal, we need solidarity and cooperation. And as you well know, we also need better data. The ability of governments to respond effectively and recover better will depend largely on the availability and quality of data. Unfortunately, the data community has also faced unprecedented disruptions in its statistical operations due to COVID-19. Therefore, the SDG reporting mechanisms, such as the voluntary national reviews, become essential as we emerge from the pandemic. VNRs are not an end in themselves, nor are they a formal exercise. They help to strengthen accountability on the commitments member states have made, take stock of progress made, and provide an important platform for partnership and multi-stakeholder engagement on the 2030 agenda, all of which is crucial to pandemic recovery. Ultimately, VNRs are a voluntary process. However, the world has changed, and in this new landscape, member states can no longer afford to not report on their progress towards the SDGs. We have to see achievements, identify gaps and priorities as we pursue the 2030 agenda. SDG reporting has to be meaningful, inclusive, participatory, and transparent. It has to be evidence-based and produce tangible solutions followed by concrete action. This is the only way we can ensure that we come out of this pandemic stronger, more just, more sustainable, and that our recovery efforts are supported by quality data and indeed leaving no one behind. Thank you, and I look forward to this discussion. And I come from Timor-Leste, and one of the issues for my country is that we don't have the capability or the capacity to actually generate the data and the information necessary to support government efforts in delivering for the people. And so one issue area that I'm interested in is the capacity building aspect of all of this for small countries that, you know, resource constraints, human resource constraints, financial constraints, and then on top of that, you know, you layer in fragilities or vulnerabilities in a post-conflict setting. How do you overcome all of that? Because for us, my country, we have really, really old data before our independence time that has been used by different stakeholders as the guide for actions taken internally. So would be really keen to hear that from our presenters. But thank you, John, so much for giving me the floor. Over to you.
Great, thanks a lot, Sophia, for your really valuable insights. And one of the things that you had mentioned is that, you know, the VNRs shouldn't be seen as an end in themselves. You know, using it as a platform for partnerships and is an opportunity to take stock of where we are in terms of progress in a particular country, to have an honest reflection on where progress is. And then based on that, for better or worse, you know, good or bad state of progress, then address what do we do collectively to ensure that this progress gap is actually addressed. So, and in a lot of cases, the issue may not be governments being dishonest necessarily, but again, as you mentioned in Timor-Leste, it's a capacity challenge. So how do we ensure that we're coming together as governments, national statistical systems, and civil society and other research institutions to ensure that governments have this data and can report in a really honest and open way. So thanks a lot, Sophia. Next, we have our colleague Dana Budicea from World Vision. She is the global lead on advocacy and external engagement. So Dana, please, the floor is yours.
Thank you, John. And I couldn't agree more. I'm already so inspired by the previous speakers. I couldn't agree more with the idea of this pandemic acting as a magnifying glass for inequality, and the fact that the girls and women are up there in the forefront of the inequalities, and for them the effort of recovering and going back to where we started before the pandemic will actually take more. And I think we're all here today because we know that the devastation of the COVID pandemic is causing in the lives of the children and their families is still unfolding. We haven't seen it all just yet. And we also know that critical services and systems that include healthcare and education and child and social protection that the local communities depend on are already frazzled. It will require a lot of concerted effort for these services to be restored. And even then, I don't think we understand yet how long it will take or if it will be at all possible for them to close this widening inequality gap. In World Vision's experience, local communities should be at the heart of any process that is aiming to restore services and strengthen systems. Because citizens, as claimants of rights, should be provided with service information, and they need to be seen as the main source of service quality evaluations. And in a time such as this, when communities' day-to-day lives are the most disrupted, their voices, these communities' voices, need to be heard even louder, because in the absence of this voice, we only have partial information on the progress or the continued need that children are facing. So helping communities engage with their government has now become part of the mainstream development practice. And in World Vision's approach to social accountability, which we call Citizens' Voice and Action, or CVND, that is being implemented across 50 countries, the communities identify service gaps, and they also advocate with local and with national governments to improve the quality of those critical services that impact the well-being of their children and the families in communities. With the recent commemoration of the World Refugee Day, I am reminded that actually we're using the term citizen a little bit loose here, because World Vision is using this approach with migrants in Thailand or refugees in Kenya, for example, to improve the services that they use. And we have been looking at evidence from external evaluations and research, and the evidence demonstrates that the CVND approach improves services as well as strengthens systems. It changes the power relationship, which is very important. It facilitates inclusion of marginalized groups, and it also contributes to empowering women and girls. But I think in addition to local changes, this process of social accountability generates such a volume of data, citizens generated, or if you want, community-driven data through participatory processes, that when aggregated, it helps to cast a light on the patterns of service failures or maybe service successes. Either way, those spaces that need the most attention by all of us, either to correct or to learn from. So the community-driven data can amplify the voices of those who are left furthest behind, or who are rarely given an opportunity to feedback their lived experience with services. And arguably, those voices are the most critical if we are to leave no one behind. Let me give you just one concrete example from the community-generated data from over 100 community clinics in Bangladesh. This data contributed to policy dialogue at the regional and national level. It reflected then in legislative changes, as well as in budgeting and in the implementation by the government, including the fact that the government recruited 600 multi-purpose health volunteers. But this is a top story. And there is massive work ahead of us towards seeing the most marginalized being able to contribute in a meaningful way to improve the services that they are using to ensure their survival. And in the past 18 months of maintaining social distancing and prohibiting gatherings to curb the spread of the virus, what happened is that the face-to-face practices of citizens' engagement and participation in monitoring the service delivery in their own communities had to be restricted. And these dynamics and challenges need to be adapted to ensure that community voices are not silenced and they are being actually heard even stronger during this pandemic. And I think we will hear some examples of such practices adaptations during this session. World Vision is currently adapting this Citizens' Voice and Action approach for community monitoring of the COVID-19 vaccine services. And this is really challenging in many of the places where we work. This is why I think this session is so timely, and I'm so honored that in collaboration with our partners in today's session, with Save the Children, with TAP Network, with Quanto, we're able to highlight the importance of unmasking inequalities and the value of citizens-generated data to leave no one behind. And we really appreciate Sofia Borges' participation with us today, because the UN Foundation is doing an extraordinary work in contributing to the SDGs. I also want to voice, on behalf of all of us, I think, our gratitude to UNDESA and UNITAR for facilitating this special event. To focus on such a critical aspect of citizens' participation. And I am so looking forward to learn from our amazing speakers today. Thank you, John.
Great, thanks a lot, Dana. And the point that you made around, how do we ensure that communities are at the center of reporting and that they're driving the data that comes from within their own communities is a really great point that we look forward to learning a lot more about in the third session on experiences on how that's actually been played out in many cases. So thanks again, Dana. So that concludes the first session. That was just an introduction and a background to the topics and issues that we'll cover in this Learning Lab, which leads us directly into this second session on tracking inequality, making the most of disaggregated data to progress the pledge to leave no one behind. We have a great group of experts from our colleague from Save the Children. Again, just a very quick reminder to colleagues watching this session to please also post questions as we go along here. So if you have specific questions for individual experts during their presentations, you can post it in the Q&A box or in the chat box, and those colleagues will do their best to respond to your individual questions throughout the session. So please do feel free to make use of the chat box as we go along here. This next session, our first colleague we have with us today is Oliver Fiala, who's a senior advisor at Save the Children. We'll hear from Oliver around Save the Children's research work around improving the availability of disaggregated data. So Oliver, I'll hand it over to you for your presentation. Thank you.
Thanks, John, and thanks everyone else for those really thoughtful introduction. So yeah, let me start with a picture you can see on the screen, hopefully. This picture shows 2-year-old Umelma, who received her measles and rubella vaccination as part of a Save the Children vaccination campaign in Wajir County in Kenya. Unfortunately, what should be a routine process is often not the case in the northeast of Kenya. And when we look at the data, we will see that children like Umelma, so children in Wajir, only 4 out of 10 of those are vaccinated with basic vaccines, much lower than the national average, which is around 7 out of 10. This example illustrates what is perhaps the most important principle underpinning the SDGs, and we have heard already a lot about the pledge to leave no one behind and the importance to reach those furthest behind first. But it's such an important principle as it is a commitment by world leaders to reduce inequality, to tackle discrimination, and the kind of a recognition that children living in Bashir, for example, count as much as a child living in Nairobi or London or New York. To breathe really life into this principle, data needs to reflect those different conditions different groups of children are facing. So for those of us who are tracking progress on the SDGs, it means we need to understand who and crucially why certain children are falling behind or why they're excluded from further development gains, for example. And data obviously plays multiple roles and has multiple functions. It helps policymakers to make better decisions. It helps us as NGOs to make better decisions, but also it provides us with such a valuable tool and such a valuable insight to hold governments, but also other institutions to account for the promises they made. Monitoring inequalities requires, we mentioned that already many times, but requires disaggregated data. What do we mean when we say disaggregated data? Just to be on the same page, we talk about indicators on health, on education, on child protection, many other SDGs, which go beyond national averages and which reveal crew-based inequalities, for example. So thinking of gender or social economic groups or geographic location, ethnicity, migration status, and so on. And global and national level statistics, which are actually the most we see when we look at progress dashboards to the SDGs, they're really helpful in showing aggregate progress, but they mask persistent underlying inequalities. And in different contexts and for different thematic areas, those disaggregation dimensions, they may look slightly different, and we will hear different examples surely throughout the presentations. But in almost all circumstances, a national level estimate alone won't tell us enough of what we need to know. When we talk about disaggregated data in the SDGs, I would like to, in the next couple of minutes, just to distinguish two bits, not a very academic distinction, but I think really helpful. One is the discussion we regularly have. It's a discussion about we need more and better disaggregated data, and that's obviously absolutely true. John mentioned it earlier, and many of the speakers already, that the SDGs very explicitly call for timely and granular disaggregated data. And we saw over the last 5-6 years, UN agencies, multilateral organizations, national statistical offices really making significant investments and efforts in monitoring SDGs using disaggregated data. And it's, for example, a key priority for the interagency and expert group on the SDG indicators, the IAG SDGs, something we very much welcome and we think is very important. But if you do take a look at the SDG indicator website and look at the global database, you will see that we are still far from where we want to be. So last year we did exactly the exercise, and we looked at child relevant indicators as they're defined by UNICEF, and 38 of those indicators do require some dimension of disaggregation in the indicator framework itself. But out of those 38, only 12 of them had all those required dimensions included there, called for. And often we probably would like to see many more than which are mentioned there. So it shows how much work is still need to be done to fill those kind of data sources. Better disaggregated data comes from loads of different sources, and we will hear much more later when it comes to citizen-generated data as one really good example. But also frequent comparable household surveys are really useful tool, and they're around forever, but they're still have so much value in there and so much granularity we don't easily get from other exercises. But also administrative data is a really useful data source we often don't utilize enough, especially when it comes to disaggregation by different characteristics. And COVID-19 has been a challenge for many statistical bodies. We know that from different pieces of research, both when it comes to the collection, for example, of household surveys, but also a lot of countries had really limited capacity to maintain even existing data work. So in a way, there is a really sad irony in there that the pandemic is not only likely increasing inequality in the actual SDG indicators, but it has actually repercussions on our ability to understand those inequalities when it is most important to do so. And there is a role, and we saw that actually quite a bit being picked up during the last year for some really innovative solutions. I'm thinking of some organizations really did a lot of investments into phone surveys. There's a lot of work going on in geospatial data and obviously citizen-generated data, which is really helpful, especially as some groups are consistently missing in, for example, household surveys. But also there is value in combining those different data sources. So for example, small area estimations are a really good example how the combination of different data sources brings a new granularity and new insights we didn't have before. But maybe just to add that, and that maybe is something a lot of participants can feel similarly about, is the challenge for our own organization and for many organizations as us to use also the evidence we generate and the data we collect better to actually understand and to contribute on SDG reporting. So all of that is that bucket of we need more and better data, which are points which are regularly made, and rightly so. But there is a second one I want to quickly mention, and that is to make better use on existing data on inequality. There is actually a lot we can already do with the disaggregated data we have, and sometimes that gets a bit lost when we talk about the need, rightly so, for more data. But we can already identify which children are most at risk, for example, as being deprived of their rights across health or education. We can distinguish subnational regions. We have even intersecting inequalities when we look at cases like poor girls, like children which are part of more than one disadvantage. And we at Save the Children had in the past actually done research project where we link, for example, that kind of data and outcomes to data of service provision, finding a double jeopardy for children, often those children who have the highest needs or the highest burden on having the lowest access to services. And we do start in the same spirit, we do start a project at the moment to better measure fiscal equity, to understand how, for example, the poorest children are benefiting from public spending. So again, the idea of using existing data, but also linking it to new projects. But we also believe, and that is the example or the point I want to get across in the next couple of minutes, we do believe that this data provides such a valuable measure of progress towards the SDGs, a measure of progress which does take the really strong leave no behind principle into account. And we do that by something that is sometimes called inclusive progress, and we think could be a really useful and powerful way to measure our progress against the global goals. Comparing trends in child outcomes across different groups and projecting those paths forward presents us with really new insights. It offers a much more dynamic view of indicators and an understanding and hopefully a visual picture that we need to move towards those goals set for 2030. And it helps us also actually to think more about policies which do help to close those gaps over time. Now, projections are obviously by nature uncertain, otherwise they wouldn't be projection, and that's even more so true in the light of COVID-19. But they do help us to understand which groups might reach the target and which groups might miss the goals set in 2030. When we used our own database, and we will tell you more about that in a second, but covering most low and middle income countries, we find that most countries are actually not on track to reach the SDG targets for children. And you see those three colors in those bars across some of the key child relevant SDG indicators, and you see that for most indicators, the dominant color is red, which means most countries will not be on track to reach the target. You see those blue/teal color, which are the countries which are on track, where basically all the groups we do look at reach the target. But then there are those yellow cases in between, which are actually a really interesting story. These are countries where we see that, or where we expect, based on past progress, the national average to be on track and some groups to reach the targets, but others not. So very clearly violating the idea that all segments of society should reach those goals and those targets we set. So reaching the SDGs is the one idea. The second one is closing gaps. The inclusive progress basically means we want to see both. We want to see progress towards the goals. We want to see things getting better, but also we do want to see gaps between the most deprived children and their more advantaged peers closing. That's what Kevin mentioned earlier as convergence. And again, using our data set, we find that most countries do not experience inclusive progress. That means children who are furthest behind from the targets are progressing actually slower than those who are further ahead. Exactly the opposite from what we want to see. Or they do live in countries where we do not see progress at all. And in some countries we see, for example, stunting rates increasing. And that all of those, just to say, all of the data is pre-COVID. So very likely those statistics would look much more pessimistic if we have more up-to-date data. We think that those concepts, both being on track and inclusive progress, go really well together, but you will find many examples where only one of them is true or neither actually. And we believe such a measure would be really valuable in voluntary national reviews, and it provides some really valuable insights how different groups are on track to SDGs using, again, all of those using data we do have already today. And I'm closing with that slide. At Save the Children, we do have developed GRID, which is our child inequality tracker. It is an illustration how disaggregated data could be presented and how it could be used for SDG reporting. All of that using data we already have today. And we would like to see examples of that being more present in national SDG platform, the global SDG database, and so on. It brings basically together key child outcome indicators across health, education, child protection for more than 100 countries, mostly low and middle income countries. And the data come from a vast majority comes from household surveys, more than 400 of them, but also from some sector-specific databases. All of the data is presented freely and publicly available on our online tools at childinequality.org. And the tools provide really a visual and interactive representation of the inequalities that do persist between different groups and across different SDG or generally child rights indicators. Just to close that, you will see those tools in a second more hands-on, but there's a wide variety of tools which you will see, and they capture all those different roles I mentioned. There will be some which help you to identify children left behind. There will be others which help you to analyze intersecting inequalities, and others who monitor progress with trends and projections over time. And you can do your own crafts, you can create your own analysis, and hopefully we hope that is a tool which could be really useful in your work. But it sounds really dry and really boring to hear about it, so I'm handing it over to Chiara, who will provide us with an exciting hands-on demo, fingers crossed, and she shows you really how you can use that by yourself. Over to you, Chiara.
Thank you very much, Oliver. Good evening, morning, afternoon, everyone. Really happy to be here. We have heard about GRID now. Let's see how it works in concrete. Let me share my screen. This is where the hopefully part starts. Great. This is GRID's homepage, and I hope that this short demo that I'm going to give you now is not only the introduction to a powerful tool that you might not know about, but also it really starts to show how these concepts that my colleagues have mentioned, from convergence to a strong equity lens, really can come to life. All right, let's get started. This is GRID's homepage. GRID stands for Group-Based Inequalities Tracker and Database, and I would just call it GRID. As you can see, GRID is divided into 3 entry points from where you can start exploring the data. We have the global dashboard, the country dashboard, and the COVID-19 dashboard. They all have different purposes. The global dashboard is used when we want to have a global, regional, or cross-country overview. For example, to have a regional average or to compare countries. We look at the country dashboard instead when we want to have a deep dive in a specific country, and we can do this, as you will see in a moment, at a very granular level, not only subnationally, but also within groups. And then finally, we have the COVID-19 dashboard. This is the, as you might expect, this is the latest addition to GRID, and it is meant to try and start closing the evidence gap around the impact of COVID-19 on children and their families. Each dashboard is in turn divided into tools. Each tool either shows different data or shows the same data, but with a different cut to it. So extracting a different key takeaway or a different message. Today, I'm going to introduce you to GRID by showing you the overview pages of the country dashboard and of the global dashboard. But I would highly encourage you to just explore GRID, play around with the different tools, and start to see a little bit more what it can do. It's especially the overview pages, as you can see right here, are quite densely packed. It can feel a little bit overwhelming to see them for the first time, but a helpful way that I think kind of understand really what GRID is this interface that is meant to be more interactive and accessible between, on the one hand, this huge backend data set, or as Oliver said, different sources or different data sets, and you, on the other hand, the end user. And the way you extrapolate the information you need from GRID is by querying the data. And in turn, the way to query the data and to approach GRID is to use the filters. Filters to select what we want to, basically the graphs to show, and they are primarily of three kinds. So on the one hand, by geography, we will select the country or the region or countries and regions we are interested in. We will select the indicator that we are looking for and we want to know more about. And finally, the groups of children and the subgroups of children that we want to see reflected in this. Let's start now with the country dashboard, where I am now. The overview page of the country dashboard provides a snapshot of the other main tools, together with some info, which is the automated text you can start to see, and I will be explaining in a moment. Already with the overview, you can start answering certain questions. To give you a flair of what you can ask GRID is, for example, what is the stunting rate in Nigeria right now? Or what is the gap in primary school completion between boys and girls in sub-Saharan Africa or in South Asia? Or which groups of children are on track to achieve the SDGs on under 5 mortality by 2030 in any given country? For the sake of time, for this presentation, I'm going to go with what the default options are. So I'm going to keep here Nigeria among the countries, but you can just select one. And I'm going to stay here with under 5 mortality. But as you can see, there are a lot of indicators. Some of them reflect directly an SDG target. And in this case, as for under 5 mortality, you can see that at the top left. Some of them don't, and in this case, they do not correspond to an SDG, and you will not see the SDG target in the graphs. So let's start from the text here. This is also quite a recent addition to GRID, and it's meant to help the user navigate the data. So this is automated text. It changes based on the filters we have. It reflects what the graphs show. And each sentence is a takeaway from the graph, so really to make it even more accessible. Moving on to clockwise, we are now in the group-based inequalities graph, which is what we would find in the group-based inequalities tool. And this is where we see the equity lens, and we start to see what has been talked about this far. You can see here for Nigeria, for under 5 mortality, that each dot represents a group of children. In red, we have the national average, and then in the other colors, we have the urban-rural divide, the wealth divide, and then in blue, we have different regions. What does this tell us? There's a lot of information here. This gives us a static view, so the latest data point available, which in this case, because it's household surveys, it's pre-COVID. So we can see that at the national level, the value for under 5 mortality is 129 per 1,000 live births. Maybe it's useful to mention already at this point that whenever you hover over a dot, which is a data point, you see this pop-up text, which shows a little, actually quite a lot of information about the value we have at hand. So, for example, the group of children, the child population it represents, and very importantly, the source, so that you know every time exactly where each data point is coming from. So we were saying 129 per 1,000 live births nationally. However, here, when we look at location disaggregation or well disaggregation, this is where we start seeing the gaps, because already we can see that the value is higher for rural children, which are this lighter pink dot. Here already we're 155, and it's even higher. So you see the distance between the dots represents the width of and the depth of the gap for the poorest, the children living in the poorest households. Here it's as high as 173 per 1,000 live births. And conversely, it's lower for urban households. So we go below 100 per 1,000 live births, and even lower for the richest households. So here we are at around 50 per 1,000 live births, which is still above what we have for the SDG target anyways. Moving on to the trends and projections, we shift here from a static to a dynamic view, meaning that we don't look at the situation and how it is or how it was when data was last collected, but we look at how it has been in the past and how we expect it to for it to evolve in the future. Basically, the projections Oliver was referring to earlier. Because this indicator is part of an SDG goal, we see here in the graph this gray dotted line, which is the SDG target. And we see here that it amounts to 25 per 1,000 live births. What were before dots are now lines. So the red line will mean the national average, the light green line will mean the poorest children, and the dark green line reflects the richest children. And what we can see here is that given this line that is slowly descending, we see that progress is happening slowly, and we can see that by 2030, no group of children is expected to reach the SDG target for under 5 mortality. Linking it again to what we mentioned about inclusive progress and convergence, we also see that the gap that exists at around 2015, for example, between the richest and the poorest still persists, because by 2030, we expect the poorest children to still be significantly more at risk of dying before turning 5 than their richest peers. So these are the conclusions we can draw from these graphs. And finally, in the overview page, we can see here a map. This displays basically the equivalent of what you can see here with these blue dots. So differences at the subnational level between regions. Here the scale helps us. This is quite intuitive. And we see, for example, that in Kebbi, the worst faring region, the value is as high as 252 per 1,000 live births. Whereas in other regions, for example, in Oyo, the value is much lower. So not only below 100, but also below 70. So here again, we have this equity lens. What is not mentioned in the overview, but is really important and links to some of the comments I've seen in the chat box this far, so policy implications and further equity considerations, is definitely the equitable access to services tool and the intersecting inequalities tool. So I would encourage you to explore these because they link input and outcome variables on the one hand, and for the intersecting inequalities, we look at what happens when 2 or more layers of disadvantage are combined. For example, not only living in a rural area, but also being a girl or belonging to the poorest households. Before moving on to the global dashboard, let me just tell you that there are a little bit of tricks of the trade that you can get familiar to when you use Grid, and that can make your experience even more accessible and easier. This is the info button, which is present in every tool and gives you tips on how to make the best of the tools, really. The flags you see here are the translations that are available in Grid is available in French and Spanish, so by all means make use of that. And this rectangle with an arrow, with a downward arrow, is the download option. So basically, you can not only create your own graphs but also download them just as they are. Okay, I'm going to move on now to the global dashboard. Let me see how I'm doing on time. Okay. The global dashboard, you will see, it's just taking a little bit to load. Here we go. Mirrors what we have seen in the country dashboard in many ways. I'm going now to use the filters, and I'm going to change the indicator to stunting. And when it comes to the region, I'm going to choose Sub-Saharan Africa. Just a moment. Okay. Great. Perfect. And here I could go even further and tailor the graphs even more and pick certain countries within Sub-Saharan Africa, for example, Sahel countries, but I'm not going to do that today for the sake of time. Here, again, you will start to see some similarities with the country dashboard. We have, in particular here, explanatory text that gives us information about the graphs. In this case, for example, where stunting is most and least widespread among the countries for which we have data, which countries right here are experiencing inclusive progress and are expected to reach the global SDG target by 2030, and what the difference and the gap is between the richest and the poorest households. Here again, we see group-based inequalities too. At this point, the red dot is not the national, but the regional average. And we can see that for stunting, it's at 34%, so more than 1 in 3 children suffering from it at the regional level. But again, if we dig deeper, if we look at inequalities, we will find that not every child is equally affected. If we look at urban children, then it's not 1 in 3, it's 1 in 4 being affected. And if we look at the richest ones, with standing at 20%, we see 1 in 5 is affected. Conversely, if we look at the more disadvantaged children, for example, the rural children, we see that 40%, roughly 4 in 10, are affected. And this goes for the poorest children as well. I'm sorry, have I run over time? Okay, I'm just going to continue. With the trends and projections, we see, again, the trajectory at the regional level. Again, sadly, we can see that the line is not very steep downwards, so progress is struggling and stagnating. And again, the gap that we saw actually in the 2000s and we see now is will continue to be a constant and is expected to be so all the way until 2030. And again, no group at the regional level is expected to reach the target by the deadline we have. Finally, the map here shows the regional average, the national average for the whole region. So basically this red dot for each country. And again, the scale, the heat map shows which countries are most affected. If we look at Niger, we see that around 1 in 2 children is affected suffers from stunting, whereas if we look, for example, at Namibia, it's a lower value, so around 3 in 10. If you have any questions, of course, pop them in the chat, and I think I'm at time, so I'm going to stop there. Thank you for your time.
Great, thanks a lot, Gira. And yeah, thanks a lot for detailing that really comprehensive resource. I think plenty of time for colleagues to unpack this a bit more themselves. But we now turn to Lily Chow, Senior Advisor from Save the Children. We're towards the very end of the session. We have just a couple of minutes left, Lily. I know obviously it'll be quite a challenge to summarize everything you'd planned to say in just a few minutes, but if you can help us gain a little bit more time back, it'd be much appreciated. So Lily, over to you. Thank you.
Thank you, John. So we've seen, obviously, presentations about how existing data on inequality can be maximized and how we can come up with different measurements and analysis for the pledge to leave no one behind. I'm just going to turn now to how governments and other stakeholders can raise accountability to the pledge to leave no one behind. I'm going to highlight 4 broad calls that we are making today to governments and other stakeholders to raise accountability. The first is around raising the bar on reporting on the SDGs. The second is around ensuring a robust chapter on leave no one behind within VNRs. The third is in fostering an inclusive process around the VNRs. And the fourth is on committing to transparency in SDG reporting. It has never been more urgent for us to raise the bar on reporting. And while we've seen that aggregate progress can be useful to tell us broadly what the direction of travel is in terms of meeting the SDGs, it is simply inadequate as a yardstick for measurement in many cases. We would encourage governments to report not only on national averages for each target, but the rates at which progress on individual SDGs are being achieved for the most marginalized and vulnerable groups and communities. We have seen that GRID, our tool, allows you to do that. But for each individual SDG, what we should be looking at is interrogating progress by addressing the following questions in VNRs. Which groups are being left behind? What are the reasons? Is progress inclusive? And how are gaps being tackled? By looking at disaggregated data for each SDG, it offers us a way to mainstream a leave no one behind lens into the VNRs. In addition, there are now specific indicators that seek to map progress towards individual SDG targets to pro-poor policies and spending. For example, for target 1.1, which as many of you will be familiar, it's to eradicate poverty for all people everywhere by 2030. We now have the indicator 1.B.1, which measures the proportion of government expenditure in education, health, and direct transfers, whether cash transfer or near cash, which directly benefit the monetary poor. So we already have within the SDG indicator database measurements of pro-poor spending. So it's time for us to become much more nuanced in the way we present data for each individual SDGs in our VNRs. So this is an example of how you could, within your VNRs, include progress that is disaggregated as you produce your VNRs, or for civil society counterparts here today, shadow reports. The next call is around producing a dedicated chapter on Leave No One Behind. The UN Secretary General's Common Guidelines in the VNRs encourages a dedicated chapter to Leave No One Behind. And here we would encourage governments to clearly identify within this chapter specific groups that are at risk of being left behind, including those for which data is not yet available. Targeting domestic inequality should be a priority in SDG implementation, particularly in the context of recovery from COVID-19. And here we would also encourage within this chapter for governments to highlight existing and planned efforts to leave no one behind, policies, programs, and report on impact. How are these policy and programs showing progress for these groups that are being left behind? And we know that data continues to be a barrier for many governments, especially in low and middle income countries. So we would encourage governments to partner with organizations to cover all segments of the population in the VNR so that it is truly representative of the national picture, including hard to reach populations such as internally displaced persons. The next point is around making the process inclusive. I am a strong believer that the process of the VNR is almost always a determinant of the quality of the final VNR report. It is absolutely essential that in the process of producing the review, we ensure the voices of most marginalized and deprived groups are included and adhere to the principles of inclusion and non-discrimination. We encourage governments to involve not just youth, but children in the VNR process. Save the Children has facilitated now child-led SDG processes such as child shadow reporting in Indonesia and Zambia, and consultations with child parliamentarians, for example, in Zimbabwe. Supporting the participation of children in SDG accountability process is both a means and an end to achieve the 2030 agenda. It builds ownership on the SDGs among a key constituent, young people, as torchbearers of the agenda. It promotes leadership and it empowers children as right holders to hold their leaders to account. And finally, the fourth point really is around ensuring that we make sure that data on the SDGs is publicly available and widely accessible, and to foster dialogue between stakeholders that are involved in data collection and monitoring efforts at the local, national, and global level. And we would also encourage governments to sign up to the Inclusive Data Charter. Just some final thoughts from me. As we gather at this year's HLPF and deliberate policy measures to accelerate progress on the SDGs in the Decade of Action, there is an urgent need to close the gaps between rhetoric, awareness, and accountability. Tackling inequality is not just an economic issue. It is a political economic problem and a social justice problem, requiring political and economic and social solutions. Accountability is ultimately the glue that ties commitment to the results. Thank you.
Great, thanks a lot, Lily, and thanks again to colleagues from Save the Children for sharing these really comprehensive tools. Again, we will share, I've seen colleagues share the links to this tool in the chat box. So for colleagues that are asking for how they can access that resource, please do check the chat box, and we'll also follow up from this as well with all the participants to share all of these resources going forward with everyone. So thanks again to colleagues for sharing that really comprehensive work from Save the Children. So moving straight on to our second session. Our second session will cover the topic of community voices and citizen-generated data. Really looking to unpack some of the work that's been done on the ground from colleagues, partners of World Vision in particular. Again, just a reminder for colleagues that have questions for any of these presenters or for any of the previous presenters, please do insert them in the chat box or in the Q&A box, and we will have colleagues try and answer questions as we go along here. So jumping straight into it, we have Winfried Ungum, who is the Social Accountability Coordinator from World Vision Uganda. So I'll hand it straight over to you, Winfried. Please, the floor is yours.
Okay, thank you, John. Welcome to this session. I'm Winfried Ungum. I'll be sharing with us how we've been able to utilize citizen-generated data to monitor and improve health services during the COVID-19 pandemic in Uganda. Looks like my screen is frozen, but I'll just carry it forward. So at World Vision, we generate our citizen data using the citizen voice and action model, which is a social accountability approach that aims to increase dialogue, improve dialogue between local governments, communities, citizens, service providers. Let's just think of it as an approach that aims to bring service users and service providers together with an overall goal to improve public services and child well-being. This model is used across 50 countries across the world in World Vision. And in Uganda, it's being implemented in 43 districts. So the overall goal is to first ensure that the communities have information, the right information. This will include policies, laws, their roles and responsibilities. And with that, they'll then have a voice to be able to speak up for themselves and be ready to have a dialogue with their respective duty bearers, local government, or the service providers, and then they are ready to lead us into accountability. So I'll share with you a case of Ntwetwe, which is a sub-county in Chankwanzi district in Uganda, how we've been able to adapt to COVID-19. When COVID-19 came through, the biggest challenge was the lockdown, because the lockdown came with very strict operating procedures, and social accountability thrives so much on numbers, gatherings. So there was a need for the community to adjust very fast to ensure that social accountability approaches or models continue to be implemented. So the first thing was to adjust the community scorecard tool. This is a tool that is used by the community to measure their satisfaction for different public services. And in this case, the focus was on health, which is maternal health, child health, and then managing COVID-19. So World Vision supported the community to develop a community scorecard tool that was able to fit within the strict operating procedures that had been placed by government of Uganda. And this took us away from focus group discussions and more to one-on-one engagements from the community-led champions of social accountability, who we call community practitioners, and the one-on-one with the different community members. And for the case of Ntwetwe, this was done with over 75 participants, which involved girls, boys, women, men, and the technical team of the health sector. So after this tool has been utilized to collect this data, we have to utilize it because it represents the voices of the community. And this tool that has all this data is analyzed, whereby we pick out all the key issues that are coming out of the community. And this is prepared into an issue brief. This is a paper that presents a statement, what the community is saying. These are our voices. This is what the problem is, and this is the evidence we have towards it. And it's fully taken as community voices. So still adapting to a COVID context, the ideal is for us to have district dialogues, sub-county dialogues, whereby leaders, duty bearers come and have an interaction with our community. But then still, because of the strict operating procedures, they had to use the district COVID-19 task force team. In Uganda, when the COVID-19 broke out and we had the strict operating procedures, the government came up with district COVID-19 task force teams. And these are teams that are really put in place at different districts to manage the spread or control of that disease. And within this team, we had district health officials and also other leaders around that specific area. So around child protection, around education. So this was a very good opportunity and a platform for us to leverage on based on the partnership we had built with the district, but also with the different civil society organizations present at the district. And after this has been presented, they come up with an action plan. This is the community together with duty bearers on each specific issue. They'll have an action towards it. It may be a commitment, which maybe have to be monitored by the community or even the political leaders, because they play a key role in monitoring service delivery. So some of the issues that were presented in Ntwetwe are on this side, on the orange bit of the presentation. This shows the community voices. That is reduction in antenatal care visits and deliveries at facilities, access to health facilities limited due to fear of COVID-19 and lack of transport. I think most of us experienced that. You're not sure whether you should go to the facility or not. And then high transport costs. Like I mentioned, there was a lockdown. And in a case whereby there was access to transport, it was 10 times the usual. It wasn't anywhere close to what they had to pay before the lockdown happened. And they were using borders. These are local motorcycles that are used for public transport. Then on top of having high transport costs, there's no ambulance at the health facility for referral services. And then there was no screening being done at the facility. So that even brings more fear. If there is no screening being done, then I'm sure I'm not safe. That's how the community spoke. Then lastly, there was no access to postnatal care, that's immunization and family planning. So I want to take us to this table. As you can see at the top, this is data from the district. So on this end is the community, on this end is the district. And I want us to focus on March. That is on the third row. You can see March. And then the second column, total ANC attendance. The lockdown in Uganda happened on the 28th of March. So attendance in March was at 408. Now, just after the lockdown in April, it dropped dropped drastically to 21. That shows you how much impact the lockdown of COVID-19 had in regard to antenatal care services for mothers. And it's also, this shows us that data from the community or from citizens complements what that district already has. It complements, it speaks, it shows you that this is what is actually happening. So I'll just go to the next slide, but if you look at the data sets, you can really tell the difference as the months keep going by. So after they've shared the action plan, they were able to register some successes, commitments were made, and in some areas, results were already made immediately. And one of the key things was travel permits were issued to improve access to healthcare. Because with the lockdown, they had to get travel permits, people to move from one place to another, especially for those who need to access health facilities. Then publicity on continuity of health services. Very many of them said they didn't know there was continuity, it's all about COVID-19 for them. But then with the publicity using the community radios, using village committee meetings, they got to know that actually we can still access the health facility for other issues. Screening of all patients at facility is ongoing right now because they're able to procure temperature guns, check temperature, and personal protective equipment was procured for the facilities. Immunization had to continue, and in this way they had to commit to make sure that the village health teams are facilitated to reach communities at different households to ensure that children get their routine immunization as scheduled. And then other beauty about social accountability, it also brings other service providers. And in this case, we had the private sector that came on board and donated 2 motorcycle ambulances, but still the district committed that in the next plan, they will have the next financial year, they will have an ambulance. And through the social accountability approach, the community will follow through this and check with the district plans for the next financial year, look at the budget framework paper presented at the district to ensure that they commit to deliver in regard to the ambulance. So in conclusion, I want us to take interest in the importance of citizen-generated data. We've seen how it complemented data from the districts, and it also gives the community a chance to speak up, because we believe that those that are affected are best placed in helping us or in ensuring that the issues they are facing are either solved or even working together with their respective duty bearers to solve these issues. Thank you so much.
Great, thanks a lot, Winifred, and very interesting work showcasing work on the ground of World Vision in Uganda. I see that there are a couple of questions in the chat box for you, Winifred, so please do, if you have a chance to answer those questions, please do, that would be much appreciated. Next on our list, we have our colleague Mathieu Andre. He's the technical lead of advocacy at World Vision in Cambodia. Unfortunately, due to the time difference between now in New York and Cambodia time right now, Mathieu is unable to join us, but we have a presentation still. He's provided an audio presentation for us along with a PowerPoint. So I'll hand it over to my colleague Arilis to share this presentation, please.
Good morning. My name is Mathieu Andre. I'm technical lead for ISAF at World Vision International Cambodia. Today I'm going to talk about the implementation of the Social Accountability Framework project and how we are trying to use citizen-generated data to improve services for the most vulnerable through this program. So during the ISAF cycle, citizens are informed on their right and on local budget. They then assess the quality of local services using citizen scorecard. Local dialogue are then supported to identify action plan, and these action plans are implemented and monitored. This annual cycle is synchronized with the planning and budgeting process at the commune level, with the objective to have action identified through social accountability to be integrated and implemented through the commune plan and local budget. ISAF was developed as an accountability mechanism within the national decentralization policy. It is led by the government of Cambodia with the support of several donors and several civil society organizations. During ISAF phase 1, 5 main civil society organizations supported the demand side of the project, so the participation of citizens in different parts of the country. By the end of phase 1, more than 750 communes had implemented ISAF. That's almost half of the country. 500,000 people were informed on their rights, on national quality standard, and on local budget. More than 250,000 people were involved on the monitoring of the quality of local services. And in all communes that took part in the project, for every year of implementation, action plans were adopted and implemented. Implementing a social accountability project of such a scale over several years allowed to collect a significant amount of data, especially the feedback of citizens. By the end of phase 1, World Vision collected and consolidated this data from different CSO organizations, allowing to develop a database with the feedback of more than 180,000 people about the services offered by more than 2,000 health centers, primary school, and commune administration. Today, we'll only present few findings from this review, but I encourage you to read our full report available online if you are interested in knowing more about this review. Taking a step back, the data suggested that a small number of issues affected a large number of facilities. As you can see in this slide, for example, the issue of staff behavior, friendliness, and politeness of the staff at health center was an issue that was raised by citizens for almost 80% of the health center covered by the project. Looking into the data, it was
Irelis, I'm afraid we've lost the sound with the presentation. We've also lost the slideshow. Okay, let's try it again. Okay, I'm afraid I have technical issues with the slide and sound. Give Irelis maybe another minute to see.
Zooming in on a specific district in the Siem Reap province, the data allows to identify the commune that have the most positive feedback and the ones that are underperforming. So ISAF phase 2 started in 2019 with the ambition to reach a nationwide coverage. However, soon after the beginning of the implementation, the COVID-19 pandemic forced the implementers to adapt to social distancing and other restrictions established by the government. However, ISAF proved to be a valuable tool to continue to support the most vulnerable even during the pandemic. First of all, the networks of volunteers and staff that had been created to implement ISAF was mobilized to raise awareness on how to prevent COVID and how to strengthen vaccine acceptance across the country. Then World Vision successfully
Okay, that's the conclusion.
Okay, thanks a lot, Irelis, for facilitating Mathieu's engagement in this discussion. And please do relay our thanks on to him for providing this information for the webinar. We can also share the presentation after this this session with participants, just in case colleagues are interested in having that presentation, and others as well. Thanks again, Aralis. Next, we have our colleague Robert Worthington, who is the director of Quantu, who will detail a little bit of Quantu's work on the Citizen Data Hub in Malawi. So, Rob, over to you.
Thanks so much, John, and thanks to colleagues at UNITAR for hosting this, and my panelists from SAVE and World Vision as well. So this presentation really sort of builds directly from the sort of topic Matteo was speaking to, which is kind of where do we get to when we start to see citizen-generated data get to scale, national level scale, so we can sort of see the picture across one country, and what can we do in that situation? But really the sort of starting point for me is a little bit different. I think ISAF is a really fascinating and sadly quite unique program, in that, as far as I'm aware, it's really the only national scale program anywhere in the world that's kind of using citizen generated data at its heart. And as I'm sure many of you would sort of recognize, the situation in other countries is often much more patchwork. There's a kind of a wide variety of different tools and approaches that are being used, and the kind of collaboration between the organizations and the groups using those tools is often more limited. And consequently, the sort of data sets that we see coming from that work are typically smaller, and there are relatively few that have a kind of a national level perspective. Which is really a big missed opportunity, I think, and particularly when we sort of come back to, why we're doing this beyond the SDGs. This is, really about improving services, improving the quality of life for communities, particularly those that are most often left behind, and something that's even more critical now in the era of COVID. So what I'd like to share with you is just kind of a few lessons from an FCDO funded program that Quantu was involved in Malawi. It was quite an adaptive program. It gave us the opportunity to kind of explore different approaches, to test different things. And through that, there were sort of three overarching questions that we sought to try and answer. Firstly, in the context of citizen-generated data, is it feasible? Can different implementers collaborate? Can they coordinate with each other? And building on that, is it possible to agree in the context of similar tools on how to collect data that is comparable? And then building further on that, is it possible to sort of agree that in ways to actually share and use that data collectively to see the bigger picture and to solve some of the more systemic problems that we obviously might see emerging from that. And within this, we focus particularly on community scorecards and public expenditure tracking surveys, although I think the kind of lessons from this work are fairly applicable to other tools. And this brought together a range of local partners from Malawi, but also some international partners, World Vision and CARE being the most sort of notable of them. So what did we learn? I think the sort of first thing is definitively we learned that actually it is possible to reach agreement on how to collect data from the same tool in a way that is comparable, which is a really critical first step towards interoperability, or to sort of put it in plain language, our ability to create a shared data set that kind of gives the bigger picture across all of our work. So to do this, we focused on what we call sort of some of the data building blocks. So these are the kind of key stages or steps in a community citizen-generated data process where different data is generated. And you can see sort of a few examples of those down the right, which relate to one of the tools we're looking at, community scorecards. And what was very interesting as we started to look at a number of different tools is there's actually quite a lot of equivalency across different types of citizen-generated data methodologies or tools. One common one, just to kind of call out, is the focus group. Almost every type of citizen-generated data involves some kind of focus group, and reaching agreement on what kind of data we want to collect about focus groups was relatively straightforward. We did try and go further with that. We wanted to sort of look really to see how we can disaggregate that data. Obviously, this isn't data on individuals, but we were keen to include the gender demographics, the age range, the disability breakdown of those groups, really important in terms of understanding the data, as we'll see shortly. So this enabled us to kind of agree on these sort of underlying data standards, which we then made available both as paper forms, but critically as electronic forms, so that the partners that wanted to could then digitize the data as well. The next key lesson from this work is that actually it is possible with some sort of facilitation and partnership building to create a shared data set. In Malawi, we chose to call this the Citizen Data Hub. It's a kind of a new data portal that's kind of managed by a group of partners there, which aggregates data in real time, finely disaggregated data from the sort of live programs of all of the implementers that are taking part. And what this does is it gives us a kind of a growing real-time national scale picture of the kind of problems that citizens and communities are identifying in relation to service delivery, particularly health, education, and water and sanitation at this point. And it really sort of goes beyond, I think, what we can see in smaller programs, in that it gives us that perspective to see what are some of the more systemic problems which we're seeing coming up again and again in different areas of the country over different timeframes, which are just not being solved. And within that, how can we look for cases where specific groups, particular groups that are often left behind, are more disadvantaged? Where are we seeing particular incidences of lower satisfaction or other sort of indications that their needs are not being met? So let's have a quick look in terms of, what we can see from this data set. So this is available now as a kind of a live data portal. Unfortunately, for the moment, the partners haven't agreed to make this publicly accessible. Otherwise, I would share the link with you, but it's available for the group of partners using it. So one of the sort of first visualizations we explored is this kind of bubble chart, which no doubt you've seen popularized by Professor Rosling. This really was very useful as we sort of started to get a growing number of indicators across all of the partners. We can see a range of different bubbles. More to the left indicates lower satisfaction, more to the right, greater satisfaction. And it enables us to kind of zoom in quickly and identify where we're seeing indicators that correlate with lower levels of satisfaction. And in the example I'm sort of calling out here of family planning indicators, we could see a couple here: male involvement in family planning, youth involvement, sort of right there in the middle, really, in terms of sort of 50, 48 out of 100. We can also look at the data spatially as well, because obviously we're looking to sort of see patterns that indicate where there may be differences. Here there are some differences. They're not enormously significant with these particular indicators. We can see Dedster, one of the districts in Malawi, the satisfaction levels are a little bit higher than in Chisi or in Cheo, but not enormously so. I think it'd be interesting in the future to kind of layer on other data sets so that we can see, are there kind of linkages to poverty or other sort of population dynamics here. Critically, though, once we start to kind of filter the data and look at it from the perspective of different vulnerable or marginalized groups, we did start to see a number of patterns. And in this particular case, when we start to look from the perspective of young people, we saw that actually the scores in some cases were as much as half of the average of the other groups, really sort of showing, how when you get to scale, the kind of the averages can really hide a lot of the interesting insights. So we could see very clearly here that, for example, availability of family planning services was scoring almost half of what the other groups were scoring. And similar with provision of counselling for women accessing family planning methods and availability of information generally regarding family planning. So what's very interesting about citizen voice in action or community scorecards is the ability to kind of drill down. So having sort of identified these patterns in the data, we can then actually now move back down to the sort of the raw data. And in particular, in many cases, the groups provided reasons why they gave the scores. So having kind of identified, young people in relation to family planning as an interesting area where there seems to be, something there that we want to understand better, we can look and see what are some of the reasons why. And just to call out a few, I think, there's clearly a sort of a lack that was expressed of youth-friendly family planning information. And also some indications of provider bias that may be affecting youth access. There are a range of other things as well, which I won't sort of highlight. So what's interesting is having kind of identified this kind of macro issue that we might have missed with smaller scale programs, we're now able to start to sort of formulate a response and look for ways in which we can develop some kind of intervention to respond to that. So this is just a sort of a quick summary of some of the work that we've been doing. I think we feel that this offers the beginnings of a blueprint to look at how we can improve collaboration and achieve greater scale with citizen-generated data in cases where there isn't a large program that can really sort of bring everybody together. This is being taken forward through an ongoing partnership with World Vision, CARE and VSO, who we're working with to replicate this model in other countries, and very open to working with and engaging with others that would like to join this. Thank you very much. Back to you, John.
Great, thanks a lot, Rob. And I saw many requests for a presentation after this, so we'll be sure to share all of these PowerPoint presentations with all of you are participating here today. So you'll have all of this information through those PowerPoints as well on top of the information we've gathered today. So our final speaker today, we have Bezi Impepo, who's the Technical Director of Social Accountability at World Vision. So Bezi, I'll hand the floor over to you. Please go ahead.
Thank you so much, John. And yeah, thank you everyone for joining this session. I'll be very brief in the interest of time and just really wrapping up based on what the other speakers have said on this session on citizen-generated data. So looking at the experiences coming from Uganda, what Rob has shared from the experience of the Data Hub in Malawi, and what you were able to hear from what we heard from Matthew in Cambodia, citizen-generated data can be very powerful in bringing about reforms at the local level, in aggregating voices to influence at a subnational level, but also to bring about reforms that cover, at a larger scale. Now, what our experience is showing within World Vision is that these experiences can bring a lot of value within the context of this critical service of the COVID-19 vaccine. We have started to adapt the use of our citizen voice adduction approach to the use to help communities monitor the COVID-19 vaccination. We have a number of countries that have started, and I think the key thing that we are noting is that it's not a one-size-fits-all, but the 4 core elements of information, voice, dialogue, and accountability can be adapted in one form or another using technology and various approaches. What we're seeing here, particularly for the vaccine, is that social accountability can help communities to understand what they're entitled to, who has the right to the vaccine, where, what, and how. We have a recent report, and I'll put a link within the chat box, which shows that, refugees, for example, have got very little access to the vaccine in a number of places based on the research that was done. Are communities being given a voice on their lived experience with the vaccination services? And are they being heard at subnational and national level? So I think just a key point that I wanted to put forward is that the time is now to amplify these voices. The tools are available, and we can work together to ensure that no one is left behind, not just for the vaccination services, but other services at large. So John, over back to you. Thank you.
Great, thanks a lot, Bezi, and also for being so brief, but saying a lot in that limited time. So that wraps up our panel discussion. We have a couple of minutes left, unfortunately, for the rest of this session. So I think what we'll do is we'll take one of the questions. There's actually 2 questions that I think are fairly good and kind of hit on some of the themes that we've discussed already today. What we'll do is we'll take these 2 questions for each of the panelists that want to respond, but the rules here are that you have to respond in a tweet size response. So up to 100 or up to 240 characters if you can. Tweet size response to these questions. One of the questions is, how do we validate government data to paint the right picture? And then there's another question about the UN being an ambitious global institution, but the problem is that it's an independent organization. How can the UN be more independent to be effective and promote equal opportunity and social justice for countries in the international community? So I think two very broad questions. So in tweet-sized chunks, if we can respond. So I'll give you just a minute to think about your responses there, because I know that's quite a difficult task to summarize points like that in such a small amount of words. And just taking advantage of my role as moderator here, wanted to also share another resource with you all that actually just launched today from the TAP network. It's called the SDG 16 Plus Civil Society Toolkit. It's a resource guide, especially for civil society, to help colleagues work and advance SDG 16 in their own context, particularly at the national level, and includes a lot of guidance around data collection and spotlight reporting. So a lot of the issues that we've discussed today provides some guidance to get you started on where you can get started to report on SDG 16 plus. There's obviously a lot of information to be unpacked today, but I'll just include the link in the chat box here, but it's very easy to find. It's just www.sdg16toolkit.org. So it actually just launched today. You are the first to actually have access to this resource. So going back to the panel, for colleagues that want to summarize these answers to these few questions, we have a few more minutes left. Anyone want to go first on this challenge in a tweet responding to these questions?
I can give the data validation a shot. Not that I'm very good with tweets, but yes, validation of data and transparency is obviously really, really important. We try to compare it against as many different data sources as possible, and we're really transparent where the data is coming from. And we hope that this really helps building trust. Last thing to say, the data we are using, a lot of that is developed in cooperation between international organizations and national governments. So there is some kind of accountability that there, and certainly household surveys have a relatively good reputation for and are being widely used in the SDGs to track our progress. So yeah, being transparent and really trying to get us hands on as many data sources as possible, hopefully help to build that trust.
Great, thanks a lot, Oliver. I see Dana, I think you're trying to...
Can you hear me now?
Yeah, much better, yeah.
I think one idea that is worth adding here, John, is that it's important to complement the information that we are seeing in government data as well, and to consider the granularity of data when we're trying to project solutions for very specific populations.
Great, thanks a lot, Dana. Any other colleagues want to take a shot at this?
Just a quick one, John. From the social accountability approach that we use in terms of validation, so it's the communities don't do it on their own. They will give their voices, but there's always an opportunity to bring these voices alongside service providers and government. And through that process, there is validation. I think if there was an issue that was being raised that government does not agree to, then they would raise it. But these are people's lived experiences. And I think that's the critical nature of citizen-generated data. People's lived experiences by nature are validated because they've lived the experience of that particular service. Thank you.
Great, thanks a lot, Bezi. Any other colleagues want to have a go? Okay, if not, I might have just one to summarize the discussion today. There's quite a lot of content that we unpacked during this SDG learning session. But I think my main message would be I think it's in order to leave no one behind and see where implementation gaps are around the SDGs, we need to ask people how they're experiencing and perceiving progress. I mean, that is exactly how we identify where additional efforts need to be, additional political will, funding, capacity building, where all of that needs to be dedicated in order to overcome the challenges that we have ahead of us. But again, thank you so much to all of our presenters. There was quite a bit of content that we unpacked today. Again, in addition to the recording will be available after this session. So for colleagues that want to share this or review this video afterwards, you can certainly do that. But we'll also share all of the presentations that were provided through this learning lab, and any of the resources that anyone has presented here. We'll provide all of the participants here with all of that information so you can access all of those resources on your own time. And thank you once again to all of you for attending. I know that there's a lot happening with the HLPF over these next couple of weeks, so we very much appreciate your attendance and your attention during these very busy weeks. And then finally, thanks once again to our colleagues at UNITAR and UNDESA for hosting this session. I think these SDG learning labs are very helpful, and certainly are very helpful for us that host these sessions to also have some of these conversations with some of our partners as well. So thanks again to everyone for joining, and we'll definitely be in touch with more information resulting from all of the conversations from this discussion. So thanks again, everyone.